Hello, welcome back to the Ask Dr. Be Good podcast, where we get to shine a positive light on all the wonderful things going on in public education. In previous podcasts, we have talked with staff and with scholars about the various programs that we have, but really, today we're going to talk about something very basic. When students don't feel well, they don't learn. And so we've brought two of our nurse medics and RNs to talk about how we keep kids healthy or try to get them healthier when they come to us maybe not feeling their best. So before we start, go ahead and introduce yourself first. Am I right?
I'm Cynthia Ferguson, and I am the school medic at Plano campus.
And I am Maggie Ortiz, and I am the registered nurse at the Mesquite West campus.
Well, thank you, ladies. Thank you for being here. So I started off by saying kids can't learn if they're not feeling well.
Right.
So how do you help us with that? Cynthia, you've been with us the longest. You want to talk a little bit about that?
Yes. Actually, it's very important, and we all know this, breakfast in the morning. That's just very essential to get our brains going and get our bodies going. But more than that, I think just the open communication between a child and a parent, if they're not feeling good, for parents to really listen to what they're saying and not just kind of push it off. Oh, okay, you'll feel better later, which they probably will, but to take it into consideration when your child tells you they're not feeling good. Ask a little bit more questions or notify one of us at the school, our child said, we're not feeling good. Can you just keep an eye on them for the day?
Okay, Thank you. Maggie?
I kind of agree with that. Kiddos come in saying they have a tummy ache or a headache, whatever it may be. And one of the things I do ask them is does mom know? And at times they tell me yes, at times they tell me no. Either way, I always call mom just to make sure that they are aware and that they know that they were here and that it was bad enough for them to come to us for any help.
Well, good. So I know that there are a lot of health-related issues that you all have to contend with during the part of your day. So Cynthia, you want to talk a little bit about those that take up most time?
Most of the time it's stomach ache, and usually it's either that they did not eat breakfast or they really have something going on, or the most common one is they just actually need to go to the bathroom.
Oh,
yes.
To do like number 2.
Yes. Yes.
Well, yeah, I can understand that. Having raised kids and then now grandkids, they do want to get busy and not pay attention to that part of their body. That
yes.
I didn't remember that. Yes.
That's one of the things we actually tell them is, why don't you go try and see if you feel any better? But yeah, that's probably the most is headaches and tummy aches that we get.
So what health issues are you running up against that are more of a serious nature?
Asthma, especially, throughout the season changes, and we're in one of those season changes right now. The rain just mixes up all this pollen and stuff that's out there, and it causes the asthma to act up. We have, diabetes. That's a big one. That's one of the more serious ones that we have to really stay on top of.
I think you both have insulin injecting scholars, don't you?
Yes.
Yes.
Yeah. Yes.
So that makes me wonder, is nutrition part of your job duties?
It is.
I
know I have one of my little ones that has diabetes. He is type 1, which is where the pancreas does not produce any insulin at all. So he'll come in before lunch and we'll go over his lunch box and make sure that there is nutritional things in there for him. And if there isn't, we talk to him about the importance of making sure that not too much sugar or carbs are eaten.
Yes, and the same at the Plano campus. We go over his schedule of food, the print off from, because he eats food at school. We print it out. We go through his lunch daily, pick out the amount of carbs that he's allowed to have, and I let him pick his menu as long as it doesn't go over his carb count for the day. And so he's satisfied knowing that he got to choose his lunch, but it's still staying within his carb ratio for that day.
I think that student's been with us for 3 years. Is he getting pretty good at that?
Actually, this one is a new
Oh. Okay.
Yes. So he's adjusting, we're adjusting, but he's doing wonderful.
Well, yeah, my sister was type 1 diabetic, and so there is life after type 1 diabetes. She's a very successful adult, and so matter of fact, she piloted the pump back in Houston when she lived there.
Wow.
So and she's a probably shouldn't say this, but she's almost 60, so you can live a very good life watching your carbs and your sugar, and then giving yourself the proper insulin. So
Right.
it's just one of the things we have to contend with, like with asthma.
Yes.
What other things are you seeing that are a little bit more serious in nature?
We have one student who has seizures, but they are very well managed with medication. So thankfully, that's not something we've had to worry about this school year, but that's another one that we have lupus. We have one with lupus
Wow.
as well.
I hadn't heard that one.
Mhm.
Okay. So you all are having to handle not only the everyday tummies and sore throats, but the more serious nature and getting them to the point to where they can function fully in school and PE and so forth. So I know that parents must be very grateful to have such competent help to make sure their child stays healthy despite whatever ailment they may have. So let's switch the conversation a little bit now to what do you want parents to know?
Well, I know that as we said, with the season changing and it's getting cold out there, make sure that if your child is sick, with a temperature of 100.4 or over, that they stay at home for 24 hours fever-free without medication. If they have diarrhea, vomiting, same thing. They need to stay at home for 24 hours or until their stools are formed. And there's a couple of other things that, it's kind of like a common sense thing for all of us, because it's easy to say, okay, you'll feel better at school, and a lot of times they do. But with some of those, it is contagious. Pink eye's contagious. There's a whole list of things that we need to just kind of all watch out for to make sure that we're not sending our child to school when they have these things that can and have another student become sick or have the same problems.
So because you were very definitive in your answer, you said 101.4.
100.4.
Oh, 100. I'm glad
100.4.
100.4 is, if it's under that, it's okay to send them to school-ish,
That's
going to
be depending, yes, on the symptoms. Some parents will send them, some won't. But that's at the point where we would also send a student home. If they got to that temperature of 100.4, we would definitely call the parent. Now, there are cases when it may be 100, but you can see that the student is having other symptoms, just is not functioning, is lethargic, and just, that needs to go home. So we'll call the parent at that time as well and allow the parent to say, let's see how they feel. If it gets worse, I will come. If it goes up, then they definitely have to come pick them up.
So fevers is one. What else?
Also, it's important for parents to know that even if their scholar is on over-the-counter medicine, that's okay. They can bring it into us. They can always keep it up there, whether it's for allergies, whether it's for a headache at times that comes along with allergies. They can have those up there as long as we have the proper documentation. I have a mom who the kiddo has bad allergies right now because of the rain and all the pollen and things like that. So she did bring some Zyrtec or whatever the medication may be. But as long as we have the correct documentation, that is okay for us to also have up at the schools.
I think that's a change in the law, isn't it? I think back 10 years ago, maybe even less, they weren't allowed to bring any and keep it with you. But I think that was a change, and a good change.
Right. And we do ask that, if medication is up at the school, whether it's prescribed or over the counter, that we are notified of it. There are forms that we keep on file. For over the counter, it has to be prescribed by a physician, and we keep those on file with the physician's signature, because there's certain questions that we ask, whether they are knowledgeable enough to carry their own medication on them, and normally that's in 6th grade and above.
Right.
And then there are over-the-counter medicines that we can administer to their child, but we have to have parent permission as well.
So let's review a little bit about the medication. Let's start with over-the-counter medication. What is allowable? And I don't mean brands. What I mean is as far as when they can carry it themselves, what age, and when it has to be checked into you.
Over-the-counter medicine, I don't allow anybody to carry that just because the school, they don't have lockers since it's the school that we do the PBL and everything. But I wouldn't want somebody to accidentally get in the wrong bag or a younger child to find it if they were to drop it. We'd like to keep all medication in our office locked up. They can come at any time that they need it, and we can administer it. And that's with over-the-counter.
Over-the-counter. Now, prescription medication, tell me what's allowable and not allowable.
Whatever the doctor prescribes, we will have it as long as we have the physician's signature stating what it is, what it's not necessarily what it's used for, but how to administer it. And 6th grade and up are allowed to carry. Normally, it's only inhalers that they're allowed to carry, or their EpiPen. And otherwise, we keep them in our office locked up until it's needed. And then when they do send those in, they have to be in a prescribed from the pharmacy, a box with a pharmacy label on there. We don't allow them to just bring in the inhaler because we don't know whose it is if it was to get lost, or what ingredients are in there if the label comes off.
So what about some of the stronger prescriptive drugs that are for like ADD and ADHD?
Those are with us.
Yes.
Those are locked up in a cabinet behind the nurse's desk usually. And as long, we have to have proper documentation. The doctor will let us know how to prescribe, how to give it, how to administer it, when it needs to be, whether it's before or after lunch. But those we do keep in a locked cabinet.
And they're considered pretty serious as far as.
Mm-hmm.
Yes. We would not want anyone to get a hold of it that it's not prescribed for.
Mm-hmm.
So let's touch on something that can happen in schools. We don't like to think about it. One of you talk about lice, and then the other one talk about pink eye. So which one do you want to do first?
I'll talk about lice. Yes, lice are those little critters that are just very annoying. They are not harmful. They are not, you can't, there's a misconception that they can jump off of your head onto somebody else or they can fly. They don't. It's usually through contact. Like I said, they are annoying, and we normally will call a parent, and if we find active head lice, we will call a parent, notify them, and ask them to make sure that they clean their child's head with a medication either over the counter or prescribed by their physician. When they return the next day, we will check their hair, and then just follow up every week from them just to help the parent make sure that they're staying on top of it. Because normally you'll see a few eggs. We just want to prevent those eggs from hatching again and becoming active lice again and starting the whole process all over.
So just a reminder to our parents that the state of Texas does not consider nits, the little white egg sacs on the hair, to be considered dangerous enough to have a child out of school.
Correct.
Mm-hmm.
So what I'm hearing you say is that if you see active lice, then a call is made. The parent is to treat the child that night and then send the child back, because then the lice are dead.
Mm-hmm.
Yes.
And then if by chance the cycle continues, because there's a cycle event that happens.
Yes.
I was a foster parent, and so I had much lice coming in, as with the little foster kids. So I'm pretty knowledgeable on this. It can take 2 or 3 weeks of treatment, but over time, especially if the parents are good about washing the bed sheets and the pillow sheets and the covers and so
Right.
forth, the clothes, that it does go away over time. It is aggravating, but it's not life-threatening.
Correct.
Right.
Correct. And there is such a thing called super lice, where the lice have become immune to some of the over-the-counter products. But that's when you want to contact your physician and, just talk to them, and they can help you find the right product for your child. And same thing, it will resolve within, the time frame as long as you stay on top of it.
Okay. Thank you. Now let's go to pink eye.
Pink eye. Yes, we haven't seen that much this year, thankfully. But it's very important for, parents to know what to look for, especially in pink eye, how to know that it is pink eye. And that's when your child wakes up with a crusted over eye with basically eye boogers. It's crusted over, the child's eyes pink on the inside. And it's very itchy and irritating to the child. And it's just basically, it's just from like dirty hands, basically, just rubbing eyes, and you can rub eyes and move it, kind of touch other things. And from what I understand, I don't think that I've had a doctor say it's very contagious. I've had one say it's not contagious. So in that aspect, I can't really say. But basically that's what the pink eye is.
Is there over-the-counter medicine for that yet?
Ooh. I don't
They
think
have
so.
an over-the-counter medicine. Honestly, I don't. I think it's just more for soothing until you can probably get to a physician to get actual drops for it.
But so they do have to go to the physician.
Yes.
That is a
Yes.
physician.
Mm-hmm.
All right. So I see more things on your list, but and that is things like sore throats, headache, rashes, earaches, ringworm, sprains, twisted ankles. They pretty much fall under much of what you've already
Yes.
mentioned to us. So let's go on and talk about the new emphasis that there is on concussions, head injuries. Can we talk a little bit about the change in the law over time, especially you've been with us now almost 7 years, Cynthia. So what have you seen as a change in the law around head injuries and concussions?
Well, I know especially within these last few years, especially last year, they have really focused on the head injuries, the concussions, especially in the schools, the UIL schools. But you have to take it serious because the studies are showing now in the older generation, like the football players now, you're seeing all these things that are coming up, and it's going back to the original concussions that they had when they were younger. So we at Plano and Mesquite at Legacy, we take the head injuries very serious. I've had parents say, well, you called me because my child bumped their head with another child, but we take it very serious because it's not necessarily the impact itself of how hard you hit somebody, but it may just be that where they hit, how they hit. So we do take it serious, and we contact the parent.
Well, we have to track that now, don't we?
I've always tracked it from day one, whether we were supposed to or not. I just felt it was good data to have to know where we're at and what's causing them,
And
or
where it's
where it's happening at. Absolutely.
And we know. I bet anybody could guess where the most of them are happening, and that's
PE/recess.
Yes.
yeah.
Yes.
Yeah, and that's when kids are most physical, and so it's up to us to make sure our adults who are watching PE or our PE teachers or the teachers and TAs that are watching kids at recess, that they really stay focused on the job.
Yes. And part of our protocol on the head injury is we have a form that we fill out. When they come to us, we kind of evaluate them. We watch them for about 30 minutes, make sure there's no changes. I've asked them questions as far as their name. Do they know the name of the school, their parents, just to make sure that we know where they're at. And then we fill out a form documenting the time and the date, contact the parent, let them know what happened. I think it's important that we contact the parent on any head injury. And then we send home a form with them that is called the ABCs of concussions. It's just a little documentation showing the parents what some signs and symptoms to look out for the next 24 hours. And most of the parents, if not all, really appreciate that call that they get just for the heads up.
Good. All right. Our next portion of the podcast, I think, needs to talk about our health screenings, because we have so many health screenings that are mandatory to do. The state of Texas looks at the schools as a place where they can maybe locate some type of future health issue early. So if you all would sort of go through your list and start talking about the screenings that you have to do and what results from those screenings.
Sure. A couple of them are vision and hearing. Those are done kindergarten, first grade, third grade, fifth grade, and seventh grade. We have them come in. We have them do their vision test. We send out a referral if we feel like, they're having some issues, if they're squinting, if they're having a hard time seeing the line of letters that we ask them. We do send out referrals for that, as well as the hearing test. Referrals are also sent out, and we follow up with the parents as well if we don't hear back, just to make sure that the child is being treated and going to the doctor and making sure that they're not needing glasses or hearing aids.
So how often, and either, I'd like to hear from both locations, how often do kids need to get further hearing tests or vision tests?
Well, I've done a couple already that I've had a couple of the SPED teachers come to me, and I have had a couple of scholars that have needed referrals to be sent out, whether it was from more vision. It was more of the vision, because they were squinting or because they couldn't see the proper line that we need them to see. But just this year, I've had maybe 2.
Yes. And over the years, it's usually been about 6%, anywhere from 6 to 10% of the students that I've screened that are referred out. Just because they're referred out doesn't mean that they have a hearing issue or a vision issue. It's just on the guidelines where we're trained. If we see something that is not, like she said, squinting or something, we refer them to a specialist so they can be evaluated that way. So it doesn't necessarily mean that they will need glasses or they do need to have hearing problems or something like that.
Okay.
We also do the acanthosis nigricans. It's the AN. This is a skin marker associated with high insulin levels and insulin resistance, and is considered a risk factor for type 2 diabetes and other chronic diseases. And what that is that we just look at the back of their neck. They lift their hair up, or the boys just bend down. We look at the back of the neck just to see if there's any darkening or leathery looking skin. And if it is, then we send them off for a referral. And that way the doctor can evaluate them.
What grades is that?
That is first, third, fifth, and seventh grade.
How often do you find darkening of the skin?
I think last year I may have had 4, maybe 5. But that's still 4 or 5 too many.
And so what happens? So they're identified, they go to a specialist, and they're watched, or they have to be careful with their diet? What?
The doctor usually will change their diet and tell the parent to just, modify this, modify that, just to see if it changes or helps. They just want to prevent them from going further along in life and possibly developing diabetes.
So they can actually change that dark spot on the back of their neck?
I honestly do not know if the dark spot itself will change, but when they do lab work and other tests, then they can determine, it either is helping or it's not helping. And then we have spinal screenings, which the state has changed this year to girls will be screened in 5th grade and 7th grade, and boys will be screened in 8th grade only. And
why is that?
It's at a certain age. Ages at 10, 14 is where they start seeing the changes in the spine and the body, and so that's where they try to catch if there's any curvature or anything like that. So at that point is where they want to do the screenings and try to catch it.
And it is a little more common in girls. That's why the girls have them. We screen them twice, and the boys are only the once.
And how often do you find a curvature of the spine?
I think I've had last year maybe 2, maybe 1 or 2, and over the previous years it's very, very minimal.
But it's important that we find them.
Oh yes. Absolutely.
So it's worth the effort and the time to find the 1 or 2, because then they get treatment. What kind of treatment do you get for that? Do you know?
Most of the time it's bracing. Most aren't as, it's not bad enough per se to have surgery, so they do bracing. And it's just a brace that they have to wear 24 hours a day, basically. But, it does help out with that curvature.
Wow. Any more on the list?
No, I think that's all for the screenings. Yeah, that's it for the screenings.
Does that make you, I would think that just talking about the screenings and the possibility of finding these things gives you great value to your job.
It does, and I've actually had probably about 4 or 5 years ago, when I was at the Dallas campus, I had a student who had been referred for vision, and it was a little questionable because the parent thought that the student was really faking it because she really wanted glasses at that time. So they took the student, had the student tested, and there's a couple of different tests or screens that you do. One of them is actual acuity. The other one is, to see if the eye movement moves and stuff, and then they evaluate them other than that. And so that's the one that I saw a little eye movement. So I documented it, sent them out, and I got a note back from the doctor that just said thank you. They were saying thank you to the school nurse, good catch. And so, I mean, that made me feel good knowing that I could help that person.
Yeah.
It's just a good feeling.
Yeah. So let's talk about the flu.
Coming up on the flu season, yes.
Mm-hmm.
There are a couple of things that it's important to know about the flu, and the cold, kind of knowing which is which. One of the main things is hand washing. Hand washing. I cannot say that enough. You go to public places not thinking, oh, let's touch the doorknobs, let's touch rails, and germs are everywhere. So you have to make sure that hand washing is very important. Symptoms as far as the flu, it's abrupt, it's quick. I can tell you from personal experience. I woke up one morning feeling fine. Lunchtime, body was aching, hurting, fever. So you have to know that it is very abrupt. As far as in cold, it's more of a gradual. Fever, usually always. Aches, chills, those are the things to look for as far as the flu. But hand washing, preventative, that is like the biggest thing.
So you're making me think also about the new way to sneeze. Are we training kids to sneeze into their sleeve?
In their sleeve.
Not into the air?
Yes.
Not into their hands. I see that still.
Yes. We have actually, I think at your campus you do too, have the signs up that show the ways to cough, to cover your cough and how to do it. I've actually gone into the kinders and first and second grades and just do a little training with them and showing them how to actually do it and let them practice it.
I always sort of wince when I see a little one sneezing into his or her hand and then picking up the pencil and
passing it on to their friend. And
yes. Oh my goodness gracious. Well, so we have reached the end of our show where now you get to ask me questions. And I thank you, by the way, for your prep on before coming here. It's a good reminder for all of us to hear from you and to know what's going on in the nurse's office. And I don't know that you guys get enough credit for what you do to keep kids healthy, and probably some staff too, right?
Yes, ma'am.
At times, yes.
Yes, and what most people don't know is that if staff members have some conditions, that they have to report them to you all in case of an emergency. Yes. So you're not only watching out for the little ones, you're watching out for the big people too. And so we thank you for that.
Absolutely.
So who wants to ask me the first question?
I do.
Okay.
It's kind of like a two-part question. What was it that made you wanted to go into being a superintendent of a charter school, especially knowing that it was more of a male-dominated role? And then the second part is, how has everybody reacted to you, your colleagues or other superintendents, being a female? Do you have to kind of toughen up and show that you are tough?
So I can answer that by saying that I didn't plan on being a charter school superintendent. Somebody came to me and asked if I would be interested. I was working for Dallas ISD as a supervisor of middle school and high school in one of the secondary learning communities. And I was walking the lowest performing middle schools and high schools and walking with state monitors. And the state monitors over the years had gotten to know me. And one of them knew somebody who was writing a charter application and needed somebody to write the educational vision part. And he asked if I were interested in writing that part and if it were selected by the school board of Texas, then I would be the superintendent of it. And so I had been in public education for 25 years. I'd taught college. I'd gotten my doctorate. I'd pretty much done everything else. So I said, well, sure. Sure. It's always easy to say yes to things that you don't quite understand, right?
Right.
Starting 3 schools at the same time. Never again. But it is a male-dominant world. But here's what I will tell you. It's less male-dominant in the charter world than it is in the ISD world. Now, having said that, it's still not even, but the charter world tends to attract more female superintendents than in the ISD world. So, having said that, I'm still usually the only female in the room when it comes to construction or architects, those type of meetings. I did the math on the directory from Region 10. Region 10 sends out a directory of all the superintendents, and they have it divided by ISDs and charters. And I noticed that only 10% of the superintendents in the ISD Region 10 world are female superintendents. So we still have some work to do. The number was higher. I think it was 37% in the charter world. So it's still not great, especially because, teaching is a female-oriented profession. Mm-hmm. And so one would think that you would have more females. Mm-hmm. And am I comfortable being in a male-dominant world? You bet. No problem.
Awesome.
Maggie?
So mine is more along the medical side, since that's what we spoke about today. Are you more of a mom's remedies, or do you run out to your pharmacy and grab something when you say have a cold or something simple?
We don't have enough time for that answer. Let me just mention that I'm not on any medication. I'm one of the only people that I know my age group that is on no medication.
That's awesome.
I don't get sick. I've not taken one sick day since I started working at Legacy 7 years ago. I credit that to my diet. Mm-hmm. I don't eat meat, wheat, corn products unless they're organic. Sugar, dairy, meat. I think I said all that right. I'm pretty low carb, high good protein, and I work out 6 days a week. When you do that, mm-hmm. you stay healthier. My immune system is so strong that I don't pick up the bugs from others. And so I can only use myself as the example to say that sort of diet keeps you healthier because it builds your immune system. So that's why you see the superintendent's wellness corner on the bulletin every week, where I use Chinese water torture to try to encourage staff to move into my direction. There have been staff members who have embraced some of the things that I do and have told me that they feel better and have lost weight and are healthier for it. Others get stubborn. They don't want me to be right. So, hopefully over time, I can continue to model the healthy practices that lead one to not getting sick. I mean, and I'll tell you, if and when I feel sniffles coming on, do the old honey and cinnamon thing, mm-hmm. and go on. So, but thank you for asking. Another opportunity to have people hopefully pay a little bit more attention to what I'm doing and want to move in that direction. So thank you very much. We've come to the end of our podcast. We want to thank you for really the work that you do. We couldn't do it without you, wouldn't want to do it without you, and our kids couldn't stay healthy without you. So thank you for that, and keep doing what you're doing.
Thank you.
Well, thank you.
Thank you for tuning in to the Ask Dr. Be Good show. For more information on Legacy Preparatory Charter Schools, visit our website, legacypca.com, or call 469-249-1099. And remember to like us on Facebook, where we stream live weekly Tuesdays at 3 p.m.